question is to the Democrats.
Could you speak louder?
The next question is to the Democrats. If the situation of the Social Security Trust Fund is a concern, and it is a concern to some, then Medicare is in crisis. The Medicare Trust Fund is forecast to be exhausted in 2024. What should we do about this?
Recently enacted health reform strengthened the Medicare Trust Fund, expanding its life by more than a decade. The Affordable Care Act will also improve care across the board, help reduce fraud, and finally close the holes in the Medicare drug coverage known as the donut hole, so that seniors can afford to buy the prescriptions they need.
You know, there's no doubt that Social Security and Medicare and Medicaid, these have been dominant political issues since they came into play. And most of our presidents, unfortunately, have been reluctant to react in response to these for the fear of losing votes. And, you know, there's no doubt that you can argue that some of these measures that are being taken are not enough and a serious reform is in order. But we do strongly believe that we're getting on the right path. We're slowly making progress in our society, and we're aware that this is coming up and that we're going to need a reform. And I think that whatever party you are, I think all of us can agree that this is an issue that we do need to make our politicians debate and talk about and actually act upon.
Republicans?
My Democratic friends over here kind of hit the nail on the head, you know, when you mentioned that Social Security was fixed for 10 years. You know, that's the kind of mentality we have in Washington. Oh, you know, it's good for 10 years.
Not Social Security.
Medicare, excuse me. Medicare is safe for 10 years. That's the problem we have, is we keep pushing the bucket, you know? 10 more years, here 10 more years pass, and we still have the same problem. The problem with Medicare isn't that, you know, we keep pushing the problem. It needs a fundamental reform is what it comes down to it. There is not enough people contributing to the system for it to last the way it's built right now. So inevitably, it goes back to what I talked about a little while back, about we're promising too much and we're not getting enough money to fulfill the promises that we made. So inevitably, we gotta have a grown-up conversation and say, look, we can't promise everything that we promised you. No, all my friends in here that are the same age, you know, we're not going to be able to rely on Medicare and these systems because they're gonna fail if we keep leaving them the way they are and saying, oh, they're patched up for 10 years. Let's fix them. Let's fix them permanently. I'll just leave it at that for now. Thank you.
Aggie Solidarity?
Well, I would wish that he had both, but you know, you could fund this no problem if there was a political will. Really, the costs for these two programs are really not that great. But that being said, that political will obviously doesn't really exist, seemingly. But that being said, Medicare and Medicaid, these are based on a private healthcare system. These are built on top of a private healthcare system, really to cover up what the market system cannot, has failed to provide. You know? And so, in order to make these soluble, in order to really solve this problem, we're going to need a nationalized healthcare system. Period. We need to take healthcare out of private hands. And really, when you look at some other healthcare programs, like, well, Social Security is not just a healthcare program, but when you look at that program, it's remarkably efficient. Remarkably efficient, especially compared to private health insurance companies. So any argument that, you know, we couldn't make a more efficient system in public hands is wrong. But I would like to ask, who's going to? You say we need more people to contribute. Who's going to contribute? Who's going to contribute when wages are stagnant? Who's going to contribute when more of our economy is based on service sector jobs, part-time jobs, jobs without benefits, jobs without pensions, things like that. And when pensions are being slowly eroded away, not slowly, actually drastically, right? So who's going to be contributing to this in the future?
Sure.
You know, I've talked to a few doctors, and I have some friends that their parents are doctors. You know, it's a really interesting situation going on in the healthcare industry. You have doctors that, you know, a majority or a big piece of their business comes from Medicaid, and they get a tiny fraction of what they're actually providing to their patients. You nailed it on the head. You know, where's this money going to come from? As it stands right now, our federal government can't afford this. We have doctors going out of business. I have friends that are thinking about becoming doctors, but you know, they're realizing, you know, it's not worth it for me. When I have a majority or a big piece of my business, especially here in a poor state like New Mexico, getting subsidized from the federal government, you know, they get paid something, and this off the top of my head, something like 75% or 80% of whatever the actual cost is. That's what the federal government reimburses them. And so when it comes to where's the money going to come from, exactly, I mean, we can't really afford it right now. And who's going to pay for the system? That's what it comes down to.
Democrats, you actually have a rebuttal.
I think I agree with Aggie Solidarity that if there's political will, we can find a way to pay. There are many market innovations that can help make Medicare better, and the Affordable Care Act, it has regulations to try to drive down the cost of Medicare, and the market will find a way. In India, there's a doctor, he has made a heart surgery hospital that has severely decreased the price of heart surgery. And it's because of this, because the more output you have, the less the cost will be, the less the input costs per unit will be. And if we can just transform, have the market, provide incentives for the market to transform themselves so that Medicare costs start, medical costs start decreasing, which they will, then this won't be as much of an issue.
The next question is to Aggie Solidarity. Healthcare expenditures in the United States totaled $2.6 trillion last year. In per capita cost in constant dollars, $2,663 in 1981, $4,762 in 1990, $6,453 per person in 2001, and last 2010, $8,402. In 2010, United States healthcare expenditures were 19.9% of the gross domestic product. What should we do about this?
I think we should nationalize it.
And you know, there's a lot of examples of this, even within the capital state, you know, where this works, and it works well, and even works cheap. But you know what? Let's take a moment. Let's look at what's happened with healthcare in the last few years. You know, the Affordable Care Act doesn't lower costs. It doesn't begin to deal with the really horrendous, inefficient system that we have in private hands. And you know what? It's a giveaway to insurance companies, and it forces people really into that horrendous system. It's forcing people to buy from private companies in a lot of cases. What we need is a nationalized healthcare system. There's a lot of examples of how to do this.
Okay.
I would personally like to say that I would like to defend the Affordable Health Care Act from the things that Aggie Solidarity said. For so long, we've been talking about healthcare reform, and I don't believe that this is the reform we needed, but I feel like it's a step in the right direction. And I do want to point out, and I believe I'm not the only person on this stage, but there are 3.4 million young adults who are now eligible to stay on their parents' health insurance plans up to age 26. To say that the Affordable Health Care Act hasn't helped anyone and hasn't solved solutions in our healthcare industry, I completely disagree with. Also, the Affordable Health Care Act it requires companies to give healthcare insurance to children under the age of 19 with pre-existing conditions. This is a personal issue for me. My brother has a pre-existing condition, and because of this act that was passed, he finally can be insured, and he finally does have his medical costs covered. I have my medical costs covered through my parents' insurance because of this act. And according to a Fox News source, an estimated 88 million Americans are expected to have improved preventative care coverage. I think the Affordable Care Act was a great measure that was passed. Do I believe that it was a complete fix and solution? No. But I think that it's definitely benefited a lot of us on the stage, and I'm sure in this room as well.
Republicans?
Well, you know, I'm totally opposed to the healthcare reform bill, but I think you mentioned probably one of the few things that I think actually are a good part of the legislation, but I tell you, those few pieces do not make the overall picture very good. You know, the question here, and I think Republicans get mischaracterized here a lot, saying we're anti-healthcare reform. You know, I don't think anyone up here really would be against saying, you know, our healthcare system is broken, we need to fix it. But the question is, are we going about it the right way? You know, my friends over here keep talking about nationalizing healthcare. Well, do you really know what that means? When we address the problem of healthcare, how do we fix it? What do we have a problem right now? We have not enough nurses. We don't have enough doctors. We don't have enough hospitals. You know, why don't we incentivize these industries to train these individuals to provide the services that we need? Giving access to everybody to a limited supply of providers is inevitably going to cause one thing, and that's the rationing of healthcare. You know, look at Canada, look at England, look at all the other people that have tried socialized healthcare. If I need a heart transplant or some kind of specialized specialist to look at me, I gotta wait half a year to make that appointment. The problem is, if you give everyone access to a limited supply of whatever, you're going to create scarcity and you're going to drive the price up. So why don't we fix healthcare by fixing it with solutions that, you know, kind of seem like a no-brainer? Let's get more doctors, let's get more nurses, let's get more hospitals. My Democrat friend over here talked about a great example of India. There's a hospital in India that specializes in heart transplants and heart transplants only. They do more than any other hospital in the world. And because of economies of scale, they have dropped the price of heart transplants, I think, almost in half. Those are the kind of innovations that we need to see here in the United States, not give everyone access to a healthcare system that is already limited supply.
Aggie Solidarity?
Well, if you guys both want to use India as the example of how our healthcare system should be, yes. But I think that this really shows the contrast between the two sides and us. From the Republicans, we see that essentially the solution is to leave us at the whim of capitalism, which we know, left at its whim, there's going to be a heck of a lot of people left out without health care, which should be a human right at this point in our history. And for the Democrats, their solution essentially is to incentivize it, is to put these little cosmetic makeups over the thing. And yes, I think that there are a couple of good things in the act, just like she was saying, but it's not enough, and it doesn't solve the fundamental problem that we have with health care in this country.